Methodology used to solve the problem. The treatment methodology used a precision medicine approach. The patient was diagnosed via genetic and flow cytometry testing. Treated with a synergistic combination of venetoclax and azacitidine, the VA scheme to induce remission and finally received an allogeneic stem cell transplant to ensure long-term recovery.
Results or findings. Main findings. The patient with acute undifferentiated leukemia was treated with azacitidine plus venetoclax. This therapeutic combination was chosen due to poor response to conventional chemotherapy in this type of leukemia. Clinical response. The patient showed significant clinical improvement after starting treatment. There was a reduction of leukemic blasts in peripheral blood and bone marrow. General condition and hematological parameters improvement during follow-up. Treatment effectiveness. The combination therapy led to disease remission, demonstrating effectiveness in a rare and aggressive leukemia. No severe or unexpected adverse effects were reported during the treatment. And finally, importance of the findings. The case highlights the potential role of target the therapies in leukemias with unclear lineage. These results suggest that venetoclax plus azacitidine may be promising therapeutic option for acute undifferentiated leukemia.
The conclusion we are fine, found, although the VA regimen has been widely used in the treatment of AML, its use in AUL has not previously been documented. This study presents the first reported case in AUL patient success- successfully treated with the PA regimen, achieving complete remissions. The findings provide preliminary evidence supporting the efficacy and the safety of the PA regimen in AUL. However, further validation in large clinical laboratory cohorts is necessary. Overall, the BJ regimen uh, represents or promising the therapeutic alternative for a patient with AUL and warrants further clinical investigation and applications.
What is the most interesting you learned from this research? 1. Venetoclax plus azacitidine achieved a complete remission in acute indifferentiated leukemia. This case report shows that the combination of venetoclax and azacitidine induced complete remission after the first treatment cycle in a patient without a leukemia with no standard treatment and very poor prognosis. This had not been previously reported in AUD. 2. The BA regimen was effective despite high-risk genetic alterations. The patients had an NRAS mutation and deletion of chromosome 5q, both associated with poor prognosis and treatment resistance. Surprisingly, the patient still responded well to the BA regimen, suggesting potential effectiveness even in high-risk cases. 3. The VA regimen may serve as a bridge to stem cell transplantation. After achieving remission with the VA regimen, the patient successfully underwent allogeneic hematopoietic stem cell transplantation, maintaining complete remission and negative minimal residual disease, highlighting the VA regimen as a valuable induction therapy.
Question: what case genetic mutation was detected and what did eventually? Answer: the EN-RACE mutation was found, which in typical indicates a poor prognosis and high resistance to start the treatment. What is the TBH regimen and how does it work? It is the combination for venetoclax and anacetate that the worsening is indicated to blood cancer, protecting the proteins and trigger leukemia cell death. What is the primary outcome of the case? Answer. The patient achieved complete remission after the first cycle, enabling the successful stem cell transplant for the long-term recovery.
Questions. What was the patient's response to the venetoclax azacitidine treatment? The patient showed a favorable response to the venetoclax azacitidine regimen with a marked reduction in leukemic blast and improvement in hematological parameters. This response indicated disease remission and clinical stabilization after treatment initiation. Were there any significant adverse effects reported during the treatment? No severe or unexpected adverse effects were reported during the course of therapy. The treatment was generally well tolerated, supporting to the feasibility of this combination in patients with acute undifferentiated leukemia. Why are these findings important for future management of the acute undifferentiated leukemia? These findings are important because they suggest that targeted therapies such as venetoclax combined or plus azacitidine may represent an effective alternative for this leukemia. This subtype of leukemia with limited treatment options, although based on a single case, results encourage further clinical investigation.
Next question that I make is what is acute indifferentiated leukemia and why it's difficult to treat? Acute indifferentiated leukemia is a rare and aggressive form to acute leukemia lacking lineage-specific markers with a complicated diagnosis and classification. It's a biological, hereditary, and low incidence limited standardized treatment options, resulting in generally poor prognosis. The second question, why was the venetoclax plus azacitidine PA regimen chosen for this patient? The venetoclax plus azacitidine regimen was chosen due to limited efficacy of conventional chemotherapy in all. This combination has shown synergistic anti-leukemia activity and an acceptable satisfied profile in AML, supporting its use as an alternative treatment for high risk AUL. And the third question, what were the main clinical and unique features of the reported patient? The reported patient was a 50 years old woman presenting with cytopenias and leukocytosis. Bone marrow examination showed a high blast count and unique analysis revealed NREAS mutation and FIQ, both of associated with adverse prognosis and inaccuracy.
Questions. Question number 1. What is acute indifferentiated leukemia? AU. AU is a rare subtype of acute leukemia that does not express lineage-specific markers of myeloid or lymphoid cells. It has a poor prognosis and lacks standardized treatment guidelines. Question number 2. Why was the venetoclax plus azacitidine regimen chosen for this patient? The BA regimen was chosen because AU responds poorly to conventional chemotherapy, and this combination has shown synergistic anti-leukemia effects and good tolerability in acute myeloid leukemia. Question number 3. What was the clinical outcome after using the BA regimen? The patient achieved a complete remission after the first treatment cycle, showing recovery of blood counts. and had no detectable blast in bone marrow before proceeding to stem cell transplantation. Question number 4. Why is this case report clinically significant? This is the first report case of all successful treatment with the VA regimen, suggesting a new potential therapeutic option for a disease with limit treatment alternatives. And question number 5. What are the limitations of this study? Okay, the main limitation is that it is a single case report, so larger clinical studies are needed to confirm the safety and effectiveness of the VA regimen in all patients. Thank you.